Go ahead and go live. I'm doing this.
Good afternoon, everybody. We are back after a little hiatus. We are back. The CareSouth Carolina Community Live podcast has returned, and we have a friend of the show returning to give us a update on the state of the vaccine in South Carolina, and maybe a little tidbit about what's going on with Johnson and Johnson. So I want to introduce Dr. Jan Kelly, Assistant State Epidemiologist, and and my partner in crime. He just made a grand entrance.
Question for everybody. I got one question for everybody before we get started. Guess who's back?
Yeah,
it's mine. It's mine, but we back too. Back.
I know they missed us. But we had some things going on. We had some work to do, and so we're back. We revamped, and here we go. All right. Yeah. And if you didn't know, my name is Mark Calhoun. I'm the Director of Social and Community Services, CareSouth Carolina. My partner in crime.
I'm Daniel Myers. I'm the MAT SUD Program Director. MAT stands for Medicaid Assisted Treatment. SUD stands for Substance Use Disorder. And so I'm the Program Director for that. And so we are glad to be back, man, really. Yes.
All right. And our guest, I gave her a brief introduction, but she can go into a little bit more. The floor is yours, Doc.
Yes.
Well, thank you so much for inviting me back, because I think it's so important for people to understand about vaccines. Getting vaccinated is a very personal choice. Each one of us has to weigh, what about our personal risk? How much am I at risk going to work, going to the store, working with my kids? How much am I at risk of being exposed to the virus? And if I am exposed, what's my personal risk of getting seriously ill with it? And so I know for me, it was an easy decision to get vaccinated, but I know people have to weigh that. It's a very personal decision. So, one of the things I hope we talk about today is that kind of risk benefit ratio, how to make that decision. And I see what you've got written on the blackboard behind you. So where are we with the Johnson & Johnson vaccine? So we can give an update about the vaccines as well.
Yes. So we really have a lot of people on edge about everything that's going on as far as the vaccines and everything else, as far as where we are, as far as how many people have been vaccinated, how close are we to herd immunity. It's a whole bunch of things that people are asking, and we're glad that we got you on so we can at least cover as much as we can about this today. So me and Marek are not going to interject. We're going to let you have the floor and just give us as much information you can about everything that's going on.
I will try. So I've got some good news and some stuff that still makes me a little nervous. The good news is over the past 11 weeks, we have had steady decreases in the number of new cases of COVID-19. We plateaued for a little while, a couple of weeks after Easter holidays, and we were worried that we were going to have a surge. So the fact that the curve just kind of flattened out is actually good news. And we are back on that little bit of a downslope. So that's good. We got fewer cases of COVID-19. We got fewer people dying of COVID-19, fewer people being in the hospital. But we still have we still have hundreds of people in South Carolina in the hospital with serious disease from COVID-19. So yeah, the trend is going in the right direction. But the fastest way we can stamp this thing out is getting vaccinated. Everybody's tired of wearing masks, distancing, et cetera. We're asking people to keep doing that because right now we are also seeing some new variants of the virus going around. But the best way to stamp out those variants and keep them from mutating into something worse is to get vaccinated. Now, with regards to the vaccines, I always look at this when I talk about risk-benefit ratio. I already talked about, one kind of risk is your personal risk. But I think of it in three categories. The symptoms a person might have after vaccination, because everybody's worried about, I don't want to get vaccinated because I heard I'm going to be sick for a couple of days. Number one, not everybody gets a lot of symptoms from being vaccinated. Almost everyone does get a sore arm, with all three of these vaccines. Almost everyone gets a sore arm the next day or two. But in terms of the other things, fatigue, aching all over, even fever, some people get that, some people don't. And the people who get it, usually it's mild to moderate. And so, 1 or 2 days of sickness compared to how you'll feel if you get COVID-19, no vaccine symptoms are worse than the actual disease. I know some people in pretty mild disease, but some people also get kind of that long hauler where their symptoms are just hang on. The other two things I think about, besides those immediate symptoms, are what about an allergic reaction? Well, we know about 3 to 5 people out of 1 million doses of vaccine, about 3 to 5 people get a severe allergic reaction where they need a shot of adrenaline or they need some medication. No one has died from that. It is a very treatable thing. Any place that you go to get vaccinated will have the expertise, will have the personnel who know how to treat you, who know how to recognize it, and they'll have the medication in place to treat you. So then the third thing is, what about the rare events? You won't know about a rare event until millions and millions of people have been vaccinated. And this is going to bring me to talking about that Johnson & Johnson vaccine in a second. We've had over 200 million doses of vaccine given in the United States. And there's a system set up by CDC, Centers for Disease Control, where they look for vaccine adverse events, meaning serious side effects. And doctors are required by law to report these things. So, for example, if somebody got vaccinated and then showed up in the emergency room with, a heart attack, doctors are required by law to report that so that CDC can look into it and say, was this just a coincidence that 5 days after their shot, they had a heart attack? These things happen. People have heart attacks. Or is it somehow related to vaccine? Because they'll look at it to see, are we getting an uptick in some condition so that, we need to look into it more as a possible vaccine-related thing? So in terms of looking for severe side effects, things that, the 1 in a million thing that people worry about, they have not found anything with Pfizer and Moderna. And as I said, we've had, for those two, we've had almost, I think it's more than 180 million doses of those vaccines. So I still urge people to get the best vaccine is the vaccine you can get soonest. And we've got it out there. I mean, there's better vaccine access than ever before. We've got more Pfizer and Moderna. We've been getting more doses every week. We've got mass vaccination clinics going on. If you're not sure where to get your vaccine, you can call DHEC and find out, and we can help guide you through about where to get your vaccine. Some of those clinics, like we've got one in Columbia right now, and that one in Columbia, no ID, no appointment, no insurance. You do not need to have insurance to get vaccinated. You do not need to show an ID card. And now you don't even need an appointment. You can get vaccinated. Now, what about that Blackboard? COVID update, Johnson & Johnson, where are we? So remember I was talking about that doctors are required by law to report if there is something, an adverse reaction, if there was some weird side effect or not so weird, some side effect that came during the time within 2 weeks of somebody getting vaccinated. And this is evidence that the system works. So there were about 6.8 million doses of the J&J vaccine given, and there were 6 cases of this unusual rare blood clot problem. This is a blood clot in the veins that are draining your skull. And so that's a rare thing, a really rare thing. And it's a serious thing. One person died from this. So it's a serious thing. So immediately, CDC and FDA, remember this is 6 cases out of almost 7 million people. So extremely rare thing, but they were able to pick up on it because of this system. They said, okay, wait, we need more information. We need to know more about this. Is it possible there are more cases out there that we don't know about, that maybe weren't diagnosed, weren't recognized? Let's stop, just put it on hold. Don't throw away your J&J vaccine. Don't send it back. Let's just wait and look into this more. And I think that is really a testament to how cautious our system is. In Europe, we may have read about there have been a bunch of blood clot cases with a different vaccine, and different countries did different things, and some were not as careful about it. But CDC said, stop, let's hold on the vaccine while we do more of an investigation. So when I say do more of an investigation, what did they do? Well, they went back to their records to say, let's make sure we didn't miss anything, and let's look at what did Johnson & Johnson do in their human trials, back in the summer and the fall. Let's make sure there wasn't something that was missed there. So they did that. But they also sent the call out to physicians all around the country saying, look back at your records. Did you see somebody that you diagnosed with a stroke, but maybe there was something else going on? Look back in your records and send us some information. And in South Carolina, we did the same thing. We sent out a message by email and by text messages on phones, because we've got a system with where we can collaborate, for example, with the South Carolina Medical Association, the Hospital Association. So we're connected to like emergency room doctors and intensive care room doctors, unit doctors. So we could send them a message saying, think about this. Have you seen any patients with any of the following things? And we described some of the symptoms of these rare blood clotting events. And we've gotten answers back from them. And the answer in South Carolina was no. We have not seen any cases of this. There's an extremely rare finding. And I know today, CDC is meeting to review what data they have. Did they uncover some new cases? I would think they might have uncovered a few more cases, but I don't think they've uncovered a lot, at least not by our experience in South Carolina. And they're going to review those cases and make a recommendation. Now, I don't know. I don't have a crystal ball. I can't say for sure what their recommendation is going to be. But I suspect if it really is a 1 in a million rare side effect, and one that CDC can now make some recommendations to doctors. I mean, they did this pause not just to find out about more cases. They did this pause so that they could educate doctors and nurses. They could say, this is what this rare thing looks like. This is how you diagnose it. Here are some things to consider. And here's how to treat it, because it is a treatable condition. That person who died, I think that condition wasn't recognized, honestly, until that person was very, very sick. So, knowing the right treatment. So this pause is given a chance for doctors around the country to learn about this condition and know how to treat it, and given them a chance to get more information on it. By tonight, we hope we'll have a decision. That decision, I guess that decision could be, sorry, no more Johnson & Johnson. But I don't think, this is just my opinion, but I don't think that's what the decision is going to be. I think the decision is going to be advise people. It's a 1 in a million side effect. I mean, we take 1 in a million chances all the time, right? There's a 1 in a million chance of getting struck by lightning. Being in a car accident is way lower than 1 in a million. So I think it may be asking people to think about what your personal risk is. If you get COVID-19, your risk of getting a blood clot is like 165,000 in a million. It's much, much higher. It's like 16% of people who get COVID get blood clotting problems. So I hope people can kind of put it in perspective. So we'll see. We should know by tonight. We'll have information out from DHEC about the J&J vaccine if it's coming back, and we certainly hope it is. But meanwhile, I hope nobody is delaying. If you've got the chance to get vaccinated today, I mean, if you're in Columbia, they're out there at that mass vaccination site. They're open 7 a.m. to 7 p.m. No appointment needed. Just drive up, walk in, and you can get vaccinated. They've got big arrangements. They can process a lot of people fast. So I would say don't delay. Go ahead and get vaccinated. But I know some people are waiting on that one and done J&J. I know that.
Yeah. A lot of people don't want to take they don't want to take the second vaccine because of the simple fact that a lot of people are saying, "Oh, I felt really bad after that." Now I took the Pfizer. I had both. I didn't get sick with either one. My wife took it as well, and with the second one, she had the malaise. She was a little blah blah, maybe a little mild grade, low grade temperature. But after a few hours, she was up and going. She was not incapacitated by any means. So if everybody, if you want to, I recommend getting what's available. We have two that's available, the Moderna and the Pfizer. So I recommend taking what's available right now. If the CDC, if they decide to release the J&J, then by all means take what you want to take. Just the more options, the better. But right now, we still want to get to a point where we can get some normality about us, where we can take those masks off. And I think this morning I read on the news where just in a couple of weeks or a month or so, that they'll be recommended that we can be outside without mask on, because there are so many vaccines that's out. And then by the end of the summer, if everybody continues to do what we're doing as far as the social distancing and everything else, that we may not have to wear masks, as often in certain places that we're doing it now. There is progress. We need to continue with that progress.
And just to share my personal experience, I also got the Pfizer just because that's what was most convenient for me. And after the first shot, I had a sore arm, but that was about it. After the second one, sore arm, and maybe I was a little more tired the next day, but for me, it just wasn't that big a deal. My husband and my son, they got the Janssen vaccine, the Johnson & Johnson vaccine. And I think it was pretty much the same thing for them, that they were maybe a little bit sore, maybe a little bit tired, but no big deal. I know other people have had worse experiences, and it's been a little bit all over the map, that some people, it just knocks them down for a day or two. But I also know a lot of employers will now give paid time off for getting the vaccine. They'll give you a couple of hours to, get out of work, go get the vaccine, and paid time off so that you don't have to take sick leave. Paid time off if you have symptoms the next day. I know a lot of employers are doing that. If yours isn't, you might want to ask, because there's also a federal program where they can take a tax credit for giving people paid time off. So, businesses, we are hoping businesses are behind this as well, making sure that their employees are vaccinated. And I would think they would want to, because if you have an employee who's not vaccinated and then they get sick, or they're just exposed and they have to quarantine, well, that's an annoyance for the business. I would think they'd rather get people vaccinated.
Yes.
But you were asking how many people have been vaccinated. So in South Carolina, we have at least 40% of the adult population. By that, I mean people age 16 and up, because you can get vaccinated right now, right down to age 16. At population 16 and up, 40% of people have had at least one dose, which is great news. It's a little closer to, I have to check the number, 27, 28% of people who are fully vaccinated, meaning they've either had the Johnson & Johnson or they've had 2 doses of Pfizer and Moderna. Now that's really good news. The thing that makes me nervous is people not coming back for that second shot, because they are only partially immune, and so that's how we get variants. When you're only partially immune, that's when it's like antibiotic resistance. If you don't take your full 10 days of antibiotics, then you may get a bug that's resistant to that antibiotic. Same deal here. You're only partially vaccinated. That's where the variants come out. Now, the variants we have in South Carolina right now, they are, they can be, sorry, I'm stumbling over my wording here. Vaccines do work with those variants, but you got to be fully vaccinated for them to work with these variants. We don't know with one shot. Yes, it gives you partial immunity, but you got to get that second one for that immunity to last, to be long lasting. The fastest way we can get out of this whole thing and get back to normalcy is going to be getting vaccinated. It's the fastest way.
And if anybody's out there watching and listening to us, and you have conversations with people who have already told you, I just took the first one. I'm not gonna take the second one because I don't want to feel bad. You need to let them know that the question is, if they miss their window for the second vaccine, would they have to start the whole process over again?
No, thank you for asking that. So it's recommended if you get Pfizer, you get the second shot 3 weeks later. If you got Moderna, you get the second shot 4 weeks later. But if more time than that has passed, that's okay. there's like no expiration date on this. So if you got vaccinated, 3 months, you got your first dose and you never came back to get your second, it is not too late. Go back and get your second. It's a booster dose that's going to boost your immune system to full protection. So, really important to get that second dose. You do not need to start all over again. Getting that second dose is what's going to give you full protection, including against these new variants.
So it's important that you tell your family and friends and acquaintances if they didn't get the second part because they was upset or they was scared or they were nervous, tell them to go back and get it. It doesn't matter when they got it, they need to get the second one so they can have full immunity. So talk to your friends and talk to your family. I understand that some people are afraid of needles. I understand that. I'm not afraid of needles, but I understand that people's anxieties are real. And so whatever we can do in our clinics that we're giving vaccines to make it a little more comfortable for you, a little less anxious for you, then we're willing to do that. But we want to make sure that everybody's taken care of in our clinics as well. So really, let's get it done. Really, I mean, we're about there. You can see daylight. 6 months ago, or 6 or 7 months ago, we would have never thought that we would be here right now, where we can actually be outside and be around family members with no mask on. But look where we are. Look how far we've come, and we can get just that much further in the next 6 months, where we won't have to worry about it at all. So maybe a little bit, but.
You're raising a really good point. So, I keep talking about all the medical benefits of getting vaccinated, that you won't get sick, that, if you're exposed, that you can still fight off the virus. But there's social benefits to this, to getting fully vaccinated as well, right? If you're fully vaccinated, you can get together with your friends and family who are fully vaccinated. We had my household, everybody's fully vaccinated. We had another couple who are fully vaccinated that, we really have only stayed in touch by phone or Zoom for the past, how long? Good Lord, almost a year, more than a year. And we finally had them over for dinner, and it was like nonstop chatter. It was just so nice to see people in person.
It is.
If you're fully vaccinated, you can get together with others. Finally, get together for dinner, card game, watching a game, whatever. It makes a huge difference.
Yes, and it's good for our medical health. It's also good for our mental health. To make sure we get all this done. Mental health, we have a lot of depression going on, a lot of isolation, and it's a whole bunch of stuff that's going on behind it. So the sooner we get done, we can get rid of people being, isolated, bring everybody back in, give them that comfort they need. We can give those real hugs and not the virtual hugs. Some people need that personal touch, that physical touch, and we need to get to a place where we can give that back to people as well. So
absolutely.
That is so true. So true.
Yeah.
Wow.
So I'm excited, Dr. Kelly. I'm excited about what's coming. And I do believe that they're going to say, yeah, let's go ahead and put it back. Let's go and put it back out there in rotation. Let's go and get people some vaccines so we can move this thing on out the way. I do believe they're going to say that today. I did hear this morning that there was a 7th person that they found with the witness, but they said that it's something now that they can treat, like you said, it can be treated, so it don't have to be a death sentence because somebody gets this disorder after the vaccine. It can be treated, so that gives us comfort knowing that we can get past this too.
Well, I'm really struck that they found 6 cases out of it's not like these were a group being seen in the same state or something. This is from all over the country. 6 cases out of almost 7 million people vaccinated. I mean, to me, I find that reassuring that they were able to, that we've got a system in place to identify if there's some strange side effect, that they can find it, identify it, educate people on how to recognize it, diagnose it, and treat it. So
that's right.
And if you take all the vaccines put together, we got over 200 million doses of vaccine, and the only serious side effect that's come up are these 6 cases.
Well, people take, and not making light of the situation about the vaccines or the sickness, but people take more chances playing the lottery, right? So we don't know what's in half the stuff that we eat.
And I don't want to, those 6 cases seriously ill, 1 death. This is a serious thing. So I don't
Yes.
mean to blow that off by any
Right.
means. But as you point out, every day, everything is a risk-benefit ratio. Whether you get in
Yes.
your car,
Yes.
every day we have to accept that life brings some risks. I think the risk of contracting COVID is still high enough that we have to worry as a community about it's still circulating, it's still out there. Yeah, it's on the downtick, but we are still getting hundreds of new cases every year. And if you look at what's going on in some other places, like Michigan, Michigan's having more than 4 times the number of cases a day than we are. I mean, cases 4 times per 100,000, per its population. And look at India. India is a mess. They're a disaster area right now.
Mm-hmm.
And part of that is because of low vaccine uptake in both places. I mean, India is really poor, and they just haven't had as much vaccine available to give people. So there's that. But in Michigan, there's still a lot of people who have, for whatever their reasons, refused to get vaccinated. And they have that British variant is circulating at a high rate. And that's the one. The thing about these variants, they're not more lethal. They're not going to make you more sick, but they are more transmissible. They're more contagious. They spread more easily. So that's what's going on in Michigan. And they're even seeing a lot more kid cases, seriously ill children. And we don't want that happening here. We are on the downslope. We want to keep going on that downslope, but those variants are here too, and they spread more easily. The best way to combat them is vaccination.
Yes.
That's right. And I look at the Navajo Indian population, how they have had success in being almost 100% having herd immunity, and how they just, and they was behind the 8 ball. It hit them hard in the beginning, but they buckled down and they adhered to the guidelines. They got the vaccines, and now they're almost at 100% herd immunity. And I give a shout out to them. That's awesome.
Yeah.
So
they've got a really tight community. They look after each other. They got their act together.
They definitely do. And just to point out, I got mine, Doc. Hey, last time we talked, I didn't have it. Remember?
Oh, that's right.
That's right. Yes. So I'm fully vaccinated, and I had the antibodies test, and I tested positive for antibodies, and I'm fully vaccinated. So
well, good for you. Good for
yes,
you.
ma'am.
And which vaccine did you take?
J&J. I did take the J&J. The first day we had it available, we did our first clinic in Bishopville. It was a mobile clinic on our Moby, and which is our Moby. We have a Sprinter van that's retrofitted to be able to administer vaccines and testing and other things. So we had one of those Moby events, and I think we did somewhere around 176 the first day we went out with J&J. And I won't number 1. I was going to be number 1, but I was number 3 in line.
Oh.
Yeah. I had a couple. Huh?
Did you take a selfie?
I did not. I forgot. I was so excited to get it. I did not. We had a couple nurses in front of me and a couple pharmacy staff, so they needed to get back to work. So I went. I sacrificed my number 1 position for them.
Well, that's the right thing.
Miss Donna Sanders asked a question: how do you get the antibodies test? CareSouth offers that test. You can get it from if you're not a patient at CareSouth, you can ask your primary care physician to order that test for you, and you can get tested to see if you have antibodies for COVID-19. You can also come here to CareSouth and have it done as well. Now, if there's a fee involved with it, I'm not sure. I know with our employees, there's no fee involved with that, but with the public, there may be a fee. But you can call our number 1-866-498-0399, and you can talk to somebody there and find out if that's a service that we offer to the public. I'm not sure.
I do want to say a couple of things about antibodies because there's some misunderstanding about them. So let's say, for example, you're not vaccinated and you think maybe you had COVID in the past, and so you get an antibody test to see if you're positive. Even if you have antibodies, because maybe you had COVID before, we still recommend you get vaccinated. And here's why. What we have found is that the antibody levels that come with vaccine are even higher than the antibody levels that you get from having the infection. These vaccines have been engineered to give you, super protection. So you get even higher antibody levels than you get with just infection. So even if you had COVID before, even if you get tested and you've got antibodies right now, we still recommend you get vaccinated. Still important to get vaccinated. The vaccines will work against these new variants. And we want to get people vaccinated before we get some other mutations that maybe do lead to a more severe virus. We want to stop this virus in its tracks. The other thing, though, the other thing I want to point out, if you get vaccinated, let's say you're fully vaccinated and you want to just check your antibodies, not all antibody tests are alike. It has to be a specific antibody test that tests for the spike protein antibody, because that's what the vaccine works on. If you just walk into some place that does blood tests, any blood tests, and ask for antibody tests, they might give you the antibody test that looks for antibodies to some other part of the virus. And it's going to look like I got vaccinated and yet my antibodies are negative. Why is that test negative? It's because it was the wrong antibody test. In general, we don't recommend getting the antibody test. We feel like if you're fully vaccinated, you can trust that. It's kind of a waste of a needle stick, your time and money to get the antibody test. We don't recommend it. We recommend getting fully vaccinated and then you're good to go. And remember, antibodies aren't the whole story. There are other things in your immune system. There are what are called memory cells. They're the ones that last for years, that remember if you get exposed, that they can react right away. So antibodies aren't the whole deal. We don't recommend getting the antibody tests. But understand that if you want to get that after you're vaccinated, you have to ask for the antibody to the spike. That's S-P-I-K-E, spike protein.
Okay. That's good information right there, Dr. Kelly. That's really good. Because being as specific as possible and not giving people false hope is very, very important. We don't want to mislead anybody.
Or false disappointment. People feel like,
right.
wait a minute, I heard that so-and-so got vaccinated and their antibody test was negative. Well, they probably had the wrong antibody test. So I know this is kind of getting in the weeds, but I think it's important people have all the information.
Well, it's been a lot of talk about the antibody test and everything else. We're at CareSouth, we're also doing I want to say the monoclonal infusion as well for people who have contracted that. And so we're trying to make sure that we cover all of our bases with everything, making sure people are getting treated at the early stages of COVID to reduce the likelihood of them being severely ill with that. So we're offering that as well.
I'm so glad you brought that up, because I think a lot of people don't even know about this treatment. I had a friend in Atlanta, and in between her first and second doses of vaccine, she got COVID. And so she called me and, she sounded terrible. She felt terrible. And, she's not a medical person. And I told her about, well, you need to call your doctor and get the monoclonal antibodies. And she said, the what? I mean, I had to spell it out for her exactly what to ask for, because she got tested at one of those drive-through test places, and so she's positive. She knows she's positive, but she wasn't talking to a physician. She called me for advice about what to do. So the deal is, whether you've been vaccinated or not, if you get sick with symptoms that you think might be COVID, get tested. Even if you've been vaccinated, because nothing in life is 100%. Maybe you've been vaccinated. You might be one of those rare breakthrough cases. If you have symptoms that you think might be COVID, then get tested. If it's positive, talk to your healthcare provider. Now, if you don't have a regular primary care doctor, talk to someone in urgent care or an emergency room. Because if you have other medical problems like diabetes, heart disease, kidney disease, then you're at increased risk of having severe COVID. And there's a treatment that they can give you. The treatment that they can give you is they give you these antibodies that were made in a lab. So maybe your immune system hasn't kicked in enough to fight off the infection. They can give you some antibodies that were specially made. They're passive antibodies. That they give you these antibodies in your vein. It's an infusion. And what that does is it immediately starts to fight the infection. So my friend, she went to the emergency room and she got her infusion of these monoclonal antibodies or passive antibodies. She said she felt immediately better. That same day, she felt much better.
That's what I've been hearing.
But I think people don't think about it. They don't know that there's anything that they can do. They think, well, I'll just go home and, take some Tylenol and hope for the best. No, early on, not everybody needs this treatment, but people who have other medical conditions to keep them from getting worse, we have those antibodies available all over the state now. And we do recommend consulting with your doctor if you've got one, or with urgent care or an emergency room to find out whether you could get these antibodies.
What's the age requirement to receive that infusion?
Sorry, I'm just stopping to think because every state does it a little bit differently. So I've got the CDC guidelines and the South Carolina guidelines in my head. And I think the South Carolina guidelines are that if you are 60 or older, that by itself is a criterion. Okay. If you're, but if you're 18 to 59, then they're looking, do you have another medical condition?
Okay.
And those medical conditions are really pretty common, right? They're medical conditions that include obesity, diabetes, heart disease, liver disease, kidney disease, cancer. That's a lot of people.
Yeah, so it really covers a large number of the population. It really covers that.
Yeah.
It does, yeah.
It's always worth asking, because you don't want to wait until you're really bad sick. You don't want to wait till you're at the point where you need oxygen or being in the hospital. That's too late for the antibodies. They need to give you other treatment. This is something that you get started early. You get started, in the first 10 days of getting sick.
Yeah.
Right. Oh, wow. Okay. Wow.
So let's see. So we've covered antibodies. We've talked about vaccine. We've talked about, that our number of cases and deaths are coming down, which is great news. What about the kids? We haven't talked about vaccine for kids.
Yes.
So the Pfizer vaccine, they did a study in kids ages 12 through 15. Now, Pfizer is the one that is approved for giving to people as young as 16. So we've already got vaccine out there for 16-year-olds. And I know, some teenagers are going to feel like, I'm 16 and I play high school football. I mean, I don't need this vaccine. I'd still say we do still see cases of young, healthy people who get seriously ill, or they get symptoms that last for a long time. So, my theoretical 16-year-old football player, he gets COVID-19, he might be, out for, 10 days while he's isolating. But when he comes back, you think he's going to be able to run as fast? You think he's going to be in the same condition? No way. And it may take him a long time to get back in shape. So, there's another reason for getting vaccinated. You figure you're young and strong and healthy. Okay, that's good. But COVID-19 is going to knock you down for a little bit. Yeah. And that little bit might last a lot longer than you want to.
Yeah.
So we're hearing stories of kids who are athletes who, it just takes them months to get back in shape. But what about vaccine for even younger groups? So Pfizer studied it in ages 12 through 15, and they found that it was 100% effective in preventing COVID-19. None of the kids who received the vaccine got COVID-19, and they were testing them routinely. They were looking for asymptomatic infection as well. They weren't just looking for sickness. They were looking for, anybody picking up the virus anywhere along the way. Whereas the kids who were in the control group who got placebo, they had 18 cases out of about 1,000 kids. So, that's very impressive. And in terms of symptoms after vaccination, is about the same as for other young adults. The sore arm, maybe a day or two of fatigue, et cetera. But, to put that in perspective, almost everybody gets a sore arm. That makes sense to me. You give this injection of this vaccine, your immune system rushes to the scene of the crime, rushes to the scene where you got that shot, and there's a reaction that it's supposed to be. That's how vaccines work. But in terms of how bad are the next day symptoms for young adults for that Pfizer vaccine, fewer than half of them actually reported fatigue, headache, nausea. I mean, maybe 30-40% of them. So
Wow.
they should anticipate it so that they don't get the shot and then the next day have a big final exam. But so right now, so where does this stand? So Pfizer has filled out the paperwork and sent in what's called an amendment. So they're just adding it to their application already. They're just adding, can we do this for down to age 12? And so CDC, FDA, they're all looking at that right now. I would expect that they're going to approve that. I mean, there were no serious side effects. It worked, it did what it was supposed to do. We've already established this is a safe and effective vaccine. We're just looking to see, can we give it to younger adolescents, younger teens? So it's hard to say exactly when, but it might be available as soon as this summer so that at least those kids could get vaccinated before the school year. Now, what about younger kids? Younger kids, they are testing that right now. And they're testing, all three of those companies are testing vaccine in kids under age 12, all the way down to 6 months of age. But that may take a while before they get all those results. They're really cautious in that age group. So, they're really scrutinizing that, going slowly on that. So that might be a while before we have vaccine for those younger kids. Fortunately, that really younger age, it's rare for them to get bad sick. Yeah, they get more mild illness.
Gotcha.
So this is one of the questions that everybody's asking, and if you don't have the answer, we understand. But I told somebody whenever I get a chance to talk to you, I was going to put it out there.
Sure.
Boosters for everybody that's been vaccinated. Is there going to be a booster or a possibility of a booster for Pfizer, Moderna, or even Johnson & Johnson?
So of course the answer is maybe, but let me expand on the maybe so that you can see what the thinking is. So there's two things to think about. One is, how long does immunity last? What we know, because Pfizer and Moderna have done these studies, is we know that antibody levels, and remember I mentioned T cells, those other memory cells, we know that those levels are high 7 months after vaccine administration. Now, that's not only 7 months, that's at least 7 months. We haven't had enough time to know how long they're going to last. But that's good news. That's good news. That's telling me that that's a pretty long duration of immunity. So lasting 6-7 months, that's great. We're just going to have to follow this out and see, how much longer it lasts. But the other piece are these variants. And that's why I keep harping on get your vaccine for lots of different reasons, but one of them is to stomp out these variants. So viruses mutate. I mean, that's what they do for a living. Viruses change constantly. That's why you need a new flu shot every year, because the flu virus changes every year. So is this going to happen with this SARS-CoV-2? Maybe, but we can do something about it. This SARS-CoV-2 does not mutate as much as influenza, as the flu. This does not change as fast as the flu. Flu is different every year, and it's always a challenge to figure out what's going to be the best vaccine for the flu every year. This one doesn't mutate as fast, but our worry is, right now vaccines work for the new variants that are going around. But what if this thing mutates into something else so that the vaccine doesn't work anymore?
Right.
And that's when you need to develop a booster. That's when you need to develop a different form of the vaccine. And I know the vaccine companies are working on that because they want to be prepared. So they're not manufacturing tons of boosters. They've got their chemists and their molecular people looking at these new variants and trying to tweak their vaccine so that they've got something ready to go if it is needed. Now, I know Pfizer has already said, oh yeah, you'll probably need a booster in 6 to 12 months. remember they make vaccine for a living. So they wouldn't mind if everybody needed to get a booster. But,
Yeah.
and it may be that this will turn into like the flu, that every year you need a booster. But we don't know that yet. I think I heard a doctor say the other day, get your second shot so you don't have to get a third. And what he meant by that was, get fully vaccinated now so we can stomp out the variants, and then we won't need a booster. And
Right.
I think there's some wisdom to that.
Yes.
So yeah, we might need a booster. I don't think we're going to need booster in 6 months, but we might need a yearly booster, or it might turn out that this is a long-lasting shot, just like tetanus shot. You get one tetanus shot and you're good for 10 years.
Right.
So that does remain to be seen. But those are the two big factors. It's are we going to see these variants changing, and so we'll need a new vaccine because of variants, and as time goes on, will we see people's immunity start to go down? Well, only time will tell. We gotta look at that. But there is something we can do about that. And that is, I know I'm a broken record here, but the thing that you can do is get out there and get vaccinated. That is the best way to crush these new variants.
Absolutely.
We were talking about social advantages. Like if you're fully vaccinated, you can get together with other people who are fully vaccinated. Did you know if you're fully vaccinated and you get exposed to COVID-19, like you're a close contact of somebody, maybe somebody you work with, or you're a school teacher and you get exposed to a kid with COVID, do you know if you're fully vaccinated and you have no symptoms, you don't need to quarantine.
Right.
You don't need to test. You don't need to quarantine. If you have no symptoms, you're good to go. So that's another good reason. Or people who want to travel, the rules had been, if you wanted to get on an airplane, even domestic travel, they were requiring, even just traveling in the United States, they were requiring it at one point that you had to show a test result, like within 72 hours of travel, or you had to show evidence that you had quarantined. You had to make some statement. Then when you got there, you were supposed to quarantine. Not if you're fully vaccinated. You're fully vaccinated. You got that vaccine card. You don't need to test. You don't need to quarantine. I mean, it might be different rules if you're traveling to Italy, but at least, in the United States, you can travel if you're fully vaccinated without having to hassle with that quarantine.
Right. Wow. I got a cruise. I got a cruise coming in December, and I'm fully vaccinated. So
excellent. Where are you going?
Ocho Rios, Cozumel.
Oh, fabulous.
Yeah, I'm ready to roll.
Excellent.
So yeah, I am definitely ready to roll. Well, we thank you, Dr. Kelly. We thank you. You're always a friend of the show. You always bring good information when you visit us. We like to make it a regular thing. Anytime something comes out and a few months has gone by, we're going to always reach out and ask if you can come on and so far, you've been blessing us with your presence, and you hit us back quick, say let's do it, and so we definitely appreciate that. And as we roll along, we definitely will continue to reach out and have you come back and give us that little update that we always look forward to.
Please do. You guys are doing such a tremendous service.
Absolutely.
I always enjoy talking with you.
Absolutely. And as an organization, we're working and doing our part to make sure the word get out, related to the vaccines. So we're going to continue to do that. Me and Daniel's going to continue to do that. And we'll work closely with you to make sure we get those updates. And you make sure you enjoy your weekend and rest a little bit, because I know you've been busy. And again, we thank you for coming and blessing us with your presence, right?
Yes, ma'am. Really. Thank you so much.
Thank you so much.
All right.
You have a good weekend.
Do the same.
All right. All right. So before we close out today, I just wanted to thank everyone for tuning in. Me and Daniel, like I said, we're back. We're ready to roll for the rest of the year. We took that little hiatus, but just a much needed rest and to be able to get some things done. But we back and we ready to roll. You know, we got a lot of good topics on deck, ready for everyone. Definitely going to be pushing everybody's to get vaccinated, get tested, and just be cautious out there. Be
Yeah,
cautious, right?
right.
Yeah.
And
Go ahead. Mm-hmm.
please,
Hey,
mask
where
up.
you at? Mask up. There you
Mask
go.
up. Listen,
Yeah, that's definitely not going anywhere. Still
no,
mask up. Still wash your hands. Take your precautions. Um, but yeah.
I'm
I'm
gonna give
excited for. Go ahead.
I'm gonna give them a little bit of financial advice today. You know, help them save some money.
Okay.
Okay. This is summertime, right?
Yeah.
And people want to look, they want to look the best in summertime. I'm going to help you save a bunch of money. If
Okay.
you wear your mask,
Right.
men, you don't have to get chapstick, and women, you ain't got
Yeah.
to worry about buying the lipstick because, hey, you're gonna be behind the mask. Wear the
There
mask
you
so you don't
go.
have to worry about none of that. Okay.
There you
Save
go.
them couple of bucks until you get everything over with and done, and then you have some money left in the piggy bank to go and celebrate when we can get out and about. I'm just playing, but really wear your mask though. Really wear your mask.
Yes. Absolutely, absolutely. So one other thing, just keep in mind a reminder that the ACA, the Affordable Care Act, has been extended to August the 15th. August the 15th, and more information about that, you can reach us out to Care South Carolina. You can call us at 866-498-0398. And you can reach us at our Facebook page or on our website at www.caresouth-carolina.com. And also keep in mind, if you need help or assistance with completing a SNAP application or more information on SNAP with the Supplemental Nutrition Assistance Program, you can reach out to us as well. All right. So this concludes us for the day, brother. Hey, welcome back. Glad to have you back. Glad to be back together again.
Yes. Back together again.
Back together again.
Right.
All right.
Peanut butter and jelly.
That's it, right? That's right. That's it. That's it. Peanut butter and jelly, ham and
That's
burger.
it. Ham and burger. Cool and aid.
Yeah, that's what I'm talking about. But
Yes.
listen, thank y'all again for tuning in. We'll be back next week. And hey, brother, I see you in the
Mm.
street.
Yes.
All right, all
You
right.
see me in the
We're
street.
we'll see you in the street.
See you in the street.
See you in the
That's
street.
right.